And not.
Okay, good morning. It is Senate Health and Welfare. It also is May 14th. We have today, tomorrow, and the next day, and then we are closed down as morning committees. So we'll continue to keep an eye on bills relevant to us and work on those from time to time. But we're going to continue our work on H91. We're going to work for about 45-50 minutes. Then we're going to take a break and then we'll come back and work on it again. And hopefully get to H237. We'll see how that goes. So Katie, want to help us out? I'm trying to remember what page we were on.
11.
That's what I thought. So before we go to page 11, I want to do a couple of turn to the budget section because there may be some language related to that budget section. We've been talking with folks and we had talked in here about in particular the role of municipalities and the work that they're doing. And then we also have Bridges for Health in the budget section, and there may be some language we want to add to that. So if we turn to page 30. So in talking with joint fiscal with Nolan, the 5 million. Katie, why don't you just walk us through what's there?
Sure.
And then we can talk about possible language inclusions, changes.
Okay. Katie McDonough, Office of Legislative Counsel. This is the appropriation for fiscal year 26. It's a total of 10 million of one-time funding. Roughly 5.9 for DCF for distribution to the community action agencies and the statewide organization serving households experiencing or who have experienced domestic and sexual violence. 515,000 to DCF for distribution to Bridges to Health. 500,000 to DCF for contractual and other system transformation assistance. And 3 million to DCF for continued development of shelter capacity at the state.
So, if we look at the, just Nolan, looking for your help here,
Sure.
Look at the 5.9 million that's there.
So for the record, Nolan Langle, Joint Fiscal Office. The information we've received from the CABS says that they need 4.5 million.
Yeah.
And then you have another 400,000 for the network. So that's 4.9. And it says 5.985. So take $1 million out of that 5.985. So it's 4.985. Then you have the $1 million for this purpose that Senator Lyons explained.
So if we have, so that means that the 4.9 million would be for the CAPS and for the network.
Yeah.
And then there's $1 million left there.
Yes.
So then what I've been talking with different folks about, and in here as well, with what can we do for municipalities who have been providing services for homeless shelters and others in their community. Thinking that if there's a way to appropriate $1 million, it doesn't have to be, or up to $1 million to DCF, that then upon recommendation of the CAPS, sort of the regional CAP, upon their recommendation, that money could be appropriated to municipalities. That's the idea there.
So I wouldn't do up to $1 million. I would just appropriate $1 million for the purpose.
Okay, up to this.
I wouldn't use the word up to. We recently had something else in opioid bills up to, and we've been told that language doesn't work. So
Okay.
by the administration. So anyway, that's news to you. Sorry. But I would just do $1 million to DCF for the purpose, and then just something along the lines of the CAP shall work with the municipality to come up with whatever.
Exactly. Suggestions.
come up with plans
Plan.
or ideas to apply to DCF or, I don't know, and then you want to have, and then talking with Lily, you want to be clear about, you want to have some guidelines what the money can't be used.
Right, so the concern was we don't want the money to be used to arrest homeless people. We would like, that the money could be used for training for public safety.
I wouldn't give examples, just.
No, I'm not, I'm just saying,
Oh.
we don't want the money, I get you on that.
Yeah.
But we're not gonna put examples in. We are going to say it would be used for services provided that, support, the homeless population. Or shelters. Within the municipality. Anything else you want to say there? Committee. I'm looking now at the commissioner.
Uh-oh.
I know this is something new and different, but at least any of your initial thoughts, and then coming back tomorrow, we can see where this lands.
Yeah, initially it looks okay to us. I do need to check with some
Yeah,
other folks.
no, that's just
We'll
fine.
come back to you tomorrow. As Lily, you gave a little bit of feedback on language, so.
That would be helpful. Okay, let's do that. But the intent is there that we know, we've been hearing from our municipalities where shelters are present. It's not for every municipality around the state, but we know there are shelters in about 6 or 7 or 8 different places, and they're the municipalities that provided services. So how can we support the work that they've done here? Okay with that one?
Can I ask a clarifying question?
Yeah.
If, I may just be dense. Is this 1 million to provide services or to plan for future services?
What do we think about that? I don't think it's provide services. In some ways, it's reimbursement for what they've done. In other ways, it's looking forward to how they will coordinate with the CAPS. Need to think about this one. And I'm hoping that DCF will also be thinking. And I'm looking at,
Planning or implementation. No one used to just.
you know,
no one used
planning
to
or
think they could just
implementation.
plan.
I don't want to really go backwards. Planning and implementation of, yeah. That's better. Okay. All right, well, we'll see what we can do here. I know this is a big step that we have not talked, we have talked about the need to include municipalities. This is a way actually to bring them into the discussion and also, you know, an incentive for them to be involved. I think that's very important. It does not guarantee funding going forward. That's not part of this. So we should be clear on that. This is not ongoing funding going forward for municipalities that have shelters. Period. It could be. I mean, as plan and implementation goes forward, we'll hear from CATS. We can't bind future legislators. Does that help? Yes. And then I'm asking the department to come in tomorrow with your thoughts on this.
Will do.
Okay, thank you. The other one is the Bridges to Health appropriation. And I guess in looking at Bridges to Health, they have a very specific sort of charge or work that they do. And we want to be sure that this funding includes providing health services for homeless people who are homeless. They already provide services for those who are impoverished. And I know they do, I think they do this already, so it's that was language. I think, Lily, you suggested some language here that would help clarify. Not that, and I understand the department is still thinking about this. I'm just saying your language is very helpful.
Yes, thank you. Good morning, Lily Sojourner with the Office for Economic Opportunity and the Department for Children and Families. I think, my question was to clarify the intent is that this would be to build on the work of this agency or help direct the agency as it relates to people experiencing homelessness,
Okay.
given the goal of this bill, as opposed to sort of a more broad exercise of their work. And so I think that was my question. And if it is the intent of the committee to have it be for those directly experiencing homelessness, then perhaps to add that language so that we can make sure we administer that funding appropriately.
Yeah, I think the intent is to support the organization so that they can provide those services to homeless, for those, under homelessness. Because if they're not there, they can't do anything. So it's a catch 22 piece, chicken and egg.
May I add one or just raise another question?
Sure.
If this is the time that we're doing this
Yes.
session, or- okay.
We'll come, and we're gonna come back to budget later, but do it now while it's in your.
Okay, I think that the agency was interested in perhaps expanding under what has been number 4, the 3 million to the Department for Children and Families for continued development of shelter capacity to include permanent supportive housing services and capacity. Again, making sure that we had a shared intent that it sounds like this is to kind of help build other capacity away from the general assistance emergency housing program. And if that's the case, that can be done both through shelter expansion as well as investments in permanent supportive housing services and capacity. And so we wanted to raise that suggestion for consideration. I'm sorry. I think it would be,
Can you say your
Oh.
question out loud?
Sorry, I was just Amy Schallenberger. I was just wondering if that included family supportive housing.
The families are what?
Family supportive housing.
Oh,
I think our intent is that it would be lowercase p permanent supportive housing capacity, which would then be program agnostic and so then could be used to support family supportive housing, the Medicaid permanent supportive housing assistance program, or other, again, lowercase permanent supportive housing services and capacity.
okay. Let's try that. But
Thank you.
Senator Gould has questions.
Thank you, Chair Lyons, just to make sure I understand and everyone understands, my constituents understand. Maybe this is for Katie, can you please go over and explain one more time the future appropriations piece? Because on the one hand, I know we can't bind the future legislature. On the other hand, every year we get into this issue with the GA program and the hotel motel program, and I'm worried that this could get caught up in the same kind of yearly struggle. So could you just please explain?
Yeah, the purpose of this language explains the future. I'll do my best. So the purpose of this language, as you said, it's legislative intent, it's aspirational, it's not binding. But the purpose is sort of to lay out the long-term plans for VHART in terms of funding. So we know in fiscal year 27 and thereafter, the intention right now is that based on one-time funding that was used, has been spent in fiscal year 25, that amount would be, that was used for GA emergency housing in fiscal year 25, would be redesignated for VHART. And then the following year is when the HOP funds would also be moved into the VHART program. So it's sort of laying out your aspirational plan in terms of funding the program and at what point different funding streams come into the program.
And so this is the place where concerns are raised about how well people are working together. And reiterate again how critically important it is in the coming months and then through the next year that everyone who is involved with this be at the table and working as carefully and thoughtfully as possible together to realize some benefit. And in a couple of ways. One, realize the benefit to folks who need more permanent housing, who need temporary emergency shelter, and to realize benefit to the organizations that are providing the services for those folks. And then realize benefit to the state in making the programs more efficient and saving taxpayer dollars, because we do not know what's going to happen at the federal level. So it's incumbent upon all of us sitting around the table. And when I say sitting around the table, I don't mean this table. I mean sitting around the table doing the work going forward, that there's a serious effort to make change that improves outcomes. Anybody? Yes. No.
The other reasons that the Human Services Committee put that language in was, one, obviously they couldn't bind a future legislature, but they wanted to make it clear that they wanted these programs to be funded. But the reason they picked fiscal year 25 is that there was also more money appropriated, budgeted in fiscal year 25 than there was in 26. So it was aspirational that, for instance, the GA housing, it was 37.5 and budgeted 0.5 and 30.5, 26. So one time, so they were trying to put a, pin where they were hoping that the programs would be fully funded, but the money would be spent to ensure its success. So that was their motivation.
We could change it to 26. I'm not sure we'll do that, but the point is that the goal is to see a decrease in the amount of money we need, because we're building more permanent places for folks. We're giving them financial support in terms of advice and how to, and jobs for employment services, all of those services that they need, whether it's substance use disorder or other. We're trying to take them out of that stream so that the stream is needed. But we'll see how it goes. I know it's not predictable, regardless of what's here.
I mean, that might be a goal, but that's a distant future.
It
That's
is.
not gonna happen right away. So we need to make sure that it's properly funded in the
In the intro.
Yeah, I mean, we're talking about temporary emergency shelter, like I just happened to get caught in a snowstorm. Some of these people are going to need long-term shelter. When they're not in an emergency shelter because it's cold, they're sleeping along the bike path and in the trees out there. I understand they brought one out last week and there were cameras. I understand they removed 10 people from the hill behind the State House last
Hubbard
week.
Park.
That's just the edge of Hubbard Park.
Yeah.
We have a long, yeah, we do.
We have a long way to go. There's no question
Yeah,
about
we're
it.
not gonna get out of pain for this.
And we do need to ensure that there is adequate
Yes.
funding and appropriate services. We get that. Okay. All right. Any other questions on this section, the appropriations section? All right, so now let's go to page 11. Oh, did you want to make a comment?
Hi, for the record, Beverly Boget from the Vermont Early Childhood Advocacy Alliance. I just wanted to note when we talk about future appropriation, that the budget for GA in the past has included base plus. Most of the money has been at one time, and I just didn't know if it was crystal clear in the way the wording is written for people who in the future years may look at that.
Right. I don't know if we can tell.
It does, it's base, it says base.
Base
one time.
and one time.
Oh, thank you. My apologies.
It's right in the bill. Okay?
Yes, good.
Oh, it's good. All right. So we're on page 11.
Okay.
All right. The Hearth Court Services, there we are. Okay.
Okay. So we're at top of page 11, Beehive Core Services. Subsection A, the department shall enter into an agreement with a statewide organization with population-specific experience serving households that are experiencing or that have experienced domestic and sexual violence. The organization shall provide or cause to be provided various shelter and case management services that support households. Subsection B, each community action agency shall offer or cause to be offered in collaboration with community partners each of the following services within its region. Supportive services, including intake assessments and services for diversion from homelessness, which shall include regional intake shelters. Household needs assessments. Individualized household plans to address identified needs. Assistance obtaining and retaining housing, including financial assistance. Navigation to other services and supports, including economic benefits. Peer-supported services. Landlord-tenant outreach, education and conflict resolution. Housing navigation services. Referral to healthcare assistance, including treatment for mental health conditions and substance use disorder provided by the designated or specialized service agencies. Job training and employment services. Services related to disability and independent living. Advocacy. Progress monitoring and interventions.
So remember, we're just gonna go through the, where the changes are sort of,
Oh, okay.
you know.
I thought
and then
we were going through
We're
the
gonna
whole
go
section.
back and go through the bill
Okay,
thoroughly.
I'm gonna pause though.
Okay.
On I, the referral to healthcare assistance, including mental health conditions and substance use disorder provided by DAs and SSAs. I'm not sure that the DAs and SSAs do as much of the substance use disorder work that I think it is more the preferred providers.
So with medical, I mean, we've got hubs and spokes.
Just the way it's written, it makes it sound
Yeah.
like the DAs and SSAs and providing substance use disorder services. Maybe that's just a flag for myself and I'll reorganize that section.
Yeah, okay.
Could you say including any treatment provided by?
What do you mean?
If you put the word any, including any treatment, for mental conditions, substance disorder provided by.
It still sort of sounds like the DAs and SSAs are providing the substances. So I'm thinking of reorganizing.
If you remember, when DMH came in here, I know, I think Jennings Hamilton that talked about their ongoing plans kind of integrating substance abuse treatment kind of into the mental health scope.
By DAs and SSAs?
I think that's what it was.
Yeah, I know, but that's a future look and
Yeah.
it's not altogether agreed with too, so be careful of that thought. We don't want to embed something here that's not reality. Yeah, no, be careful, no, be careful of that thought. You can think all you want.
Okay, I will reorganize that.
So,
Van,
go ahead.
Similarly, I wonder about like J and K. Also maybe being part of that.
Or
Overall, like,
services.
well, just more of the referral piece as well. Or again, I know above it's also the cause to be offered, so maybe, I just think for I, J, and K, I think those three to seem potentially a little outside of scope, or if it's clear, like
Well, it's offered
only as they
across-
relate to their sort of like housing plan also, as opposed to. And I just wonder about those three maybe together, but
A different way of phrasing that
right, that section.
Just to
about.
say referral to instead of.
So which section are we talking?
So J, you want to say referral to?
Well, it's cause, offer or cause to be offered. So at the lead-in. Know how, so you're concerned that you get so far away from that phrase that you forget. You're not actually doing it.
Well, I think it, I mean, I think that I just want to make, or I'm just trying to be clear on intent because I think this is really related to services related to their housing plans. Is that correct? Right? These are like housing related services and efforts. And so to have this seen in that context, but maybe I'm overthinking it.
Don't overthink it.
Those next three subsections could be about convening the local and state providers to provide that access. Not
Which
necessarily
three?
provided
I'm trying to figure out which three we're talking about.
I, J, and K.
Well, offer or cause to be offered. So there would be navigation too.
Yeah.
Maybe that's what you want to say?
I think so.
Okay, I mean, we can add that language in. Navigation too would be kind of a heading for just about everything here. Not. Some of this is not.
Okay. Okay, I have that.
Amy, did you want to comment?
I don't think it's necessary.
Okay. Brenda, you wanted to comment?
Brenda Siegel and Homelessness Vermont, for the record. I just have a slight concern with the navigation too, especially around services related to disability and independent living. Because sometimes we hear on our end, well, we referred them to this, but it never actually happened, and the other provider didn't actually do it, and then there's no one for it to fall back on in order to figure out how to then get them connected to the right service.
Yeah, that was I think that's one of the reasons why we include the DAs and the SSAs in here, making that part of their charge. So that is an issue.
Yeah.
So maybe there's a way to, I'm looking at the administration for this. We need help with that to ensure that that's happening. Because that was the intent there.
Thank you, Chair. So you would like some accountability language, it sounds like.
Or, I mean, before when it said cause offered or cause to be offered, that meant that if the service that they were referred to didn't pan out, didn't work and fulfill what on either end didn't work, there was some obligation then to find one that does. And that's something that has been missing, I think, from homelessness services.
Yeah.
And that often falls back on organizations that are there for the fall through the cracks.
Right.
And I don't think that's really the best, most functional way.
Okay, so we hear you and we agree that there needs to be something in here. I'm looking at the commissioner. Maybe there's a way to work with Katie.
Yes, we can come up with some language there, Madam Chair. And there's language further down in the bill
Yeah,
around
there
designated
is.
agencies. And so whether there's not.
No, the recommendation
Oh,
from the department was to take.
that was it.
But I think if it's
We
addressed,
looked at
if it's
for you.
addressed here, then we're fine.
So we need to clarify what the meaning there is. Okay, we'll get it. Sooner or later, we'll go back and forth. Okay. All yours, Kate.
Okay, subdivision 2, the operation of extreme weather event shelters. Oh, you didn't want to go in detail. So yesterday we went through all the changes and then we started walking through in detail. So
Let's go through all the changes
You
here.
wanna go
We
through the
haven't been through
changes?
the rest of the bill. And
okay,
then we'll come back and we're gonna go through the whole bill.
okay,
And we'll look at maybe some of the changes that we've made.
okay. So just the latest changes, which is the like.
Well, and how they fit. So we got use of hotel and motel.
Okay. So this, we're at the bottom of page 2207, subsection A. It is the intent of the General Assembly to decrease reliance on hotel and motel rooms for emergency housing. Annually, as shelter capacity increases in each region of the state, the use of hotel and motel rooms for emergency housing in that region shall decrease. Annually, as part of the department's budget presentation, the department shall set goals for increased housing capacity, including shelter beds, permanent supportive housing, and permanent affordable housing, in addition to proposed corresponding decreases in the use of hotel and motel rooms. The department shall provide data pertaining to the percentage of increased shelter capacity from the previous fiscal year in each region and how that increase impacts the corresponding hotel and motel room usage for emergency housing in each region pursuant to this subsection for the purpose of informing regional planning and expectations.
So it's a iterative process between regions and departments, so there's some continuing relationship there in regions.
And you have your goal setting language. Yeah. The bottom of this section, subsection D, we talked about this yesterday. And it sounds like this language doesn't capture it. So if a hotel or motel is being utilized, a community action agency shall enter into agreements for the use of hotel blocks, of hotel and motel rooms, and negotiate the conditions for use of those blocks, including access for providers and case management or other supportive services, and strategic placements that avoid isolating certain populations. The conversation yesterday was that we would break this language that's in green into a subdivision 3 and say something along the lines of using use of strategic placements without isolating certain populations from the wider population being served. Right. So I will make that change in draft 4.1. In 2208, the department and agency of human services shall have statewide responsibility for meeting the intent of the chapter. And so this section is the duties of the department. In subsection B, we have a list of all of the responsibilities of the department. These will be codified and will be in the green books on an ongoing basis. One of the changes was to develop and maintain standards for the core services listed in section 2206 of this chapter, including the operation of community-based shelters. So previously it had just been developing and maintaining standards for the operation of community-based shelters, and this expands that so that there would be standards for all core services. 2209 is the regional planning and needs assessment. No changes there. 2210 reporting requirements. Plenty of changes here. So this you have decided not to have on a monthly basis. Instead, you'll have it the last day of every third month. The department shall submit a report in consultation with the community action agencies and the statewide organizations serving households experiencing domestic or sexual violence to the various policy committees and joint fiscal. And then we have a list of everything that shall be addressed in these reports. Subdivision 6, you're adding language instead of and supportive services, and any supportive services they are receiving in conjunction with their housing, so it's not assumed. Subdivision 7, the number of households that may be transitioned to permanent housing in the coming months. 2211, regional advisory councils. There is green highlighting here, but this you have already been through in detail. This is because we're recodifying it here, which is why it's repeated. So the changes that you made earlier are retained here.
Okay, so the reason it's repeated is to codify it.
To recodify it in a different location. Yep. That is the end of the changes for 2026, July 1, 2026. And then July 1, 2027, there is a change to the purpose section of the chapter. And that is that funding from HOP would be part of VHARD. So the purpose section is changed to include.
This is going to be the hardest lift, I think, for people. Now I'm looking at the commissioner behind you. Go ahead.
Thank you. Sorry, I'm hiding behind Katie. Just to go back to the reporting section, we have a group of us trying to make those reporting requirements doable and practical and better with information that we do have available. So we'll have some suggestions for you tomorrow. on modifying the reporting.
Okay, can I suggest this? That we need those suggestions so Katie can integrate it for tomorrow.
Okay,
Can we do that?
I think so. I think we're moving.
Because we are,
This afternoon.
yeah.
It won't be major changes,
Okay.
but we do want to make sure that we can provide what they're asking.
Okay, so here's the deal. We are, ooh, I don't like that phrase. Anyway, we have to have this bill out no later than Friday. Katie has a massive amount of work to do in here and every other place. So we need to have this language for tomorrow.
Okay,
And any changes that you're gonna suggest. Because we've got 2 days to finish it off.
got it.
So, okay,
That's the deal.
thank
We
you.
need it for tonight so that she can integrate it, so that Katie can integrate it, so that we can see it tomorrow. Yeah, okay, just clarifying. Got it.
I guess.
The earliest I can get it would be
Early as
the best.
possible.
Yes.
Okay, can we do that?
Yes,
Okay, good. Thank you. That'd be great.
thank you.
Feel like I'm got the. Let's go.
Back down here.
Shall I continue on?
Page 21, is that where we are?
That is, yeah.
Yeah, okay.
So as a refresher, this is the section of implementation planning. This contains 2 reports that DCF is going to come back with. One is in October and the other is in January. So subsection A is what is coming back to the policy committees and joint fiscal in October. One item is the process that community action agencies would follow to conduct their regular regional assessments. The regional assessments, while there is one that would take place before the chapter takes effect, the chapter also contains an ongoing one. So this would be the process that governs those regional assessments. And the language you've added is including consideration of municipal needs such as public safety.
So my question is, do we want to just end that sentence as needs? Because there's other things besides public safety, other infrastructure needs, could be transportation. So, yes, Commissioner.
One of the changes we had suggested, Madam Chair, was to remove the regional advisory councils from the October 1 reporting, because they likely would not be up and running or participating in that by then. Because, yeah, the October 1st report recommends the process for working with regional advisory councils and how those would
I
function.
don't see how you can eliminate the caps from that.
No, the regional advisory councils on lines 4 and 5.
Okay, so Katie, help me out here. Oh, this is implementation.
Yeah.
So it's not green books,
You
it's
have
session law.
Yeah, you have 2 reports that are coming back from the department, one in December, one in January. The community action, the regional advisory councils, they're authorized as of July 1 in terms of how long it will take them to convene and get organized. I can't say.
I'd like to leave it. I know you don't want to leave it, but if they can get it together, that would be great. I'm looking at Amy.
Amy Schollenberger for VCAP. Madam Chair, number 1 in the recommendations for the October 1st report is the process that the CAPs are going to use to work with the regional advisory councils. And so it seems backwards to have the advisory councils up and running and participate. There won't be a process agreed on to work with them until after the October 1st report. There could be meetings and things like that. The CAPs aren't saying they won't meet with people. It's just that for this report, it's an agreement between DCF and the CAPs what the process will be.
Okay, so then it would just, I get it now. All right. So the community action agencies and the statewide organization, and take out that phrase, regional advisory council established pursuant to, take that phrase out. Is that what you're suggesting? Yes, I do.
Thank you.
Okay,
Yes.
okay. And then the question about the sentence, ending the sentence needs on line 17. Does that make sense rather than offering a single example of public safety? Then we could put transportation, we could put food shelf, we could put whatever we want to do. Just, is that okay? Okay.
Top of page 22, that was just a typo that's me corrected. Subdivision 5 and 6 are new elements for the October report. The first is a timeline for the implementation of core services listed in 2206 for the first 6 months of fiscal year 27. The second is recommended intake and assessment processes to determine appropriate shelter type for households based on program eligibility.
This is still the October report.
Correct.
May I make a suggestion for number 6?
I'm sorry, I didn't hear you.
May I make a suggestion for number 6?
Sure.
I wonder if instead of shelter type, it's just shelter and services, because again, the bill is more than just shelter, and so recognition that there may be different. So not just the shelter, but I think it's the process for the whole range of services.
And services.
That makes sense.
Thank you.
So appropriate shelter and services for households. So yeah.
Yeah, thank you so much.
Cool. Okay.
And now we've transitioned to the January 15 report. Various report backs, in subdivision 4, it had said the expanded use of 211 within the intake system. Now it reads the role of 211 within the intake system. Subdivision 5, whether access to all or some services should include an expectation regarding household participation in case management services or other expectations such as night limits on the use of hotels and motels. And if so, what elements and in what circumstances participation in case management services or other expectations should be applied. Subdivision 7 is new, whether intake and assessment processes should include verification of residency, homelessness, and household income.
Are we okay with that? I don't like it personally. But I'm just one voice. And so the decision making on this is between DCF, CAPS, and the network.
What do you mean by residency? Yeah. To me, residency is you live here in a house, you're a resident. You live here more than 6 months of the year. If you don't live here more than 6 months of the year, you're not a resident. You don't pay taxes here. What do we mean by residency? What are they? Yeah, what do we tell you? Verify that I didn't just drive in from New York last night. If I live in some towns, that's a block. And I'm driving around looking for housing. What does it verify? That I'm a real Vermonter?
No. So I'm gonna turn to Commissioner Winters with his hand up.
I can try. There are a lot of different definitions of what it means to be a resident or to reside, whether it's for voting or for a driver's license or for receiving student aid, or they're 17 or something like whatever it all means.
I have an address. I have a residence.
Most of it does. It's residing, like actually being here, or an intent to reside is the second clause of that that's often used, and that's demonstrated by acts consistent with that intent. DMV has a whole page of things that show that you intend to reside here. Some of those things would be very difficult for a person experiencing homelessness, but we believe you should ask the question. We should ask the questions to the extent it's possible to ensure that someone is not coming to Vermont solely for the housing benefit.
It's a legitimate question. It doesn't mean that that will result in eliminating people from the program, but if this is a consideration, whether to us and how. Senator Brewer, go ahead.
It is legitimate. I agree. It's a question. I think it assumes like a level of executive functioning and, you know, almost like a skill set to be able to like prove all of these things, your income, where you live. It just seems like it's going to end up being a barrier for folks. And I know there's a weather, so this is like part and parcel of a bigger questioning, but
Yeah.
it's
If the question is, do we trust the decision makers with this sentence? So whether to consider this, and it's coming back in a report in January. It's a tough one.
My friend, who's homeless for a number of years. And I had a wonderful talk with her this weekend. She's doing wonderfully. Yeah, she has housing. This was someone who spent every afternoon with her housing voucher, calling every apartment advertised anywhere. At one point, she talked after 2 years of not being able to find housing here. She talked about going to New York to look for housing. If that were reversed and somebody was living in New York, Fort Anne in New York, and they had been trying to find housing over there for X number of years, or in Plattsburgh, and they said, I'm going to come over and try Vermont. Would we put that woman and her 2 kids back into living in her car?
I hope not. I'm looking at the commissioner to answer that question.
Not sure I quite follow the question.
If someone had been looking for many, many months or years in Vermont or in New York for a place to live, and they hadn't found it, couldn't use their voucher, and then went to the other state to look, came to this state to look, would we kick them out?
I don't think so. An intent to reside, they've got a history in Vermont. They perhaps have connections to Vermont, like those things can show an intent to reside here.
But I mean, to Senator Cummings' point, you know, this is like a region, right? You've got state borders, but we're all living in like this region, and Plattsburgh is close, and you know, Fort Anne, or you know, borders are made up lines. You know, people migrate across borders all the time.
Whitehall to Rutland.
I understand all of that. It's just that when we have a limited resource and we have to prioritize who gets it, this is one of the things that I think.
So my question here is, this doesn't make a decision, right? This says whether, and whether should include verification of residency.
This is a report and recommendation.
Yeah, it is.
in January.
So we'll be back in January with this dialogue. But it's probably a valuable discussion and recommendation to be made. So there will have to be some data supporting any decision that comes along with it. And that comes from the people working on the ground. And then the whole policy considerations about our limited resources. Okay. Well, I for one would like to leave it in, because I don't think we can make this decision here. I think there's a difference of opinion. Yet within the administration and the CAPS or others who are working with those who are homeless. And this is not our decision right now. This is coming to us in January. We're going to have to trust that the people who are working on this are going to work, intently. Be back. So, can we leave
It'll be
it
a
for
fun
now?
summer.
Maybe we got some miracle that comes and. Okay,
We have to leave in a few minutes.
I know, Katie has to leave in a few minutes. We're fine. Let's keep going. So I see where we are. We're on page 24 and we have a whole list of things. We did talk about barriers in the hindrance section. That. Yeah, no, okay, so we,
Well, let's see, stand up.
okay, we will come back.
Are we gonna hear?
So
So I have a couple comments on this page. Are we gonna hear exactly to
let's come back, which page, 24?
24, yeah.
Yeah, let's come back to 24, because we don't want to start a robust discussion and then
Okay.
drop it in the middle. So Katie and Senator Gulick need to leave, and we're gonna take a quick break, and they will be back at
Momentary.